the Games of the 30th Olympiad in 2012 are awarded to the City of London.
The National Health Service has got a big problem with staff sickness. It's a high stress industry, and we know that for things like mental health, stress related problems, back injuries, lifting people, we're at higher risk perhaps than other sectors. What we're looking for really is to try and improve our staff sickness, and we know that giving them opportunities to stay well and healthy in all kinds of ways, including physical activity, is a really good idea. From the taxpayer's point of view, it's cost the NHS £1.7 billion a year in sickness absence, and clearly that's not very good from those individuals' perspectives also. So we're hoping to save at least a third of that in terms of the money, and we know that can employ an awful lot of doctors and nurses.
Within the North West, we had a particular programme called the NHS Challenge. It's really energised and encouraged staff to work together in teams, and it's been quite motivating for individual trusts, and it's helped support their health and wellbeing campaign.
One of the most important parts of London 2012 was leaving a lasting legacy in terms of the health and wellbeing of the country. And I always believed that getting the National Health Service involved with 2012 was important. So I was delighted when Mike Farrar got involved. He was the kind of the champion of physical activity within the National Health Service, along with Sue Henry, to create the NHS Challenge. And I think it's a perfect kind of marriage. An NHS looks after the nation's health, and they have a programme to help improve the health of their own employees and to get the best out of them. For every company, the most important asset they have is their employees, the people who provide their services, make their products, and if you can get the best out of them, you'll get the best out of your company. And part of the way of getting the best out of people is if they are healthy, they're active, they look after themselves. Any employer, whether they're within the public or the private sector, can benefit from investing in their employees' well-being.
There's something for everybody today, and I think, again, we do so much for patients to be healthy. I think this is something for staff to keep us healthy and motivated. It's good to get a bit of time out, and because obviously the NHS is quite a stressful place, and it's nice to do something different, a bit more fun.
I think it's really important that we sustain the enthusiasm that we've shown this year and carry it forward for future generations.